Dr. Spero, will employers have to worry about employee COVID outbreaks later this year as we move into the fall and winter?
Unfortunately, yes. We were hoping no, but unfortunately, yes. With half the people, more than half the people potentially not being vaccinated, the Delta variant, and then the winter spike. And it won't be just the winter spike in COVID, it'll also be the winter spike in flu and colds, and we won't know who has what. So everyone's going to want to know if someone has flu-like symptoms, if they have COVID or if they have just the flu or a cold. So symptomatic testing will be very important, and possibly surveillance testing will also be important.
And what are the benefits of surveillance testing on an employee population?
Well, the nice thing about surveillance testing is that it reassures, well, it does two things. It picks up people who have COVID before they come into the workplace so they don't infect other people. But during this winter, it will also be helpful to reassure people that are coming to the office don't have COVID. They may have a symptom, a cold-like symptom, but it gives them an extra layer of peace of mind, so to speak, that we're checking on a regular basis, even asymptomatic people, to see if they have COVID.
And what are the options for testing employees at the work site or at home?
Well, for symptomatic testing, you really want to use molecular testing. So PCR is the gold standard, but now there's quite a few rapid molecular tests. There's a rapid PCR test by Visby. That can be very cost effective if you do pool testing. There's Lucira testing, which is another molecular test, high sensitivity test that can be self-administered and also done at home. And then there's the Abbott ID Now test, which is also a molecular test. There's also antigen tests that can be used for surveillance testing. Antigen tests like the Binax Now are appropriate for surveillance testing if you're doing it frequently. If you're doing it, once or twice, a couple times a week, surveillance testing, then even though it's not as sensitive, if you're doing it that often, you can pick up cases that way.